Hi everyone, my name is Liliana and my topic is teen pregnancy. My target audience is going to be 15 to 20-year-old males and females. And with the survey, 70% were 20 years and older, so I'm also going to incorporate that as my target audience. My topic title and why. According to the CDC, in 2017, a total of 194,377 babies were born to women between the ages of 15 and 19. This was a low amount since it dropped 7% from 2016, which is a good thing. Birth rates also fell 10% for women who are between the ages of 15 and 17, and 6% for women who are 18 and 19. There isn't a really clear reason for the decline, but evidence suggests that the decline is due to more teens abstaining from sexual activity, and those who are sexually active are using birth control more than previous years. So I'm going to be going over factors that can contribute to teen pregnancy and how it can be preventable. It is important to provide knowledge and resources to teens so when they are ready to be sexually active, they know what to expect and how to prevent pregnancy. Like they have more resources and more knowledge so they can choose what suits them and what they want to do. So for my outline, I'm going to start by introducing myself and incorporating an icebreaker game so participants can introduce themselves. Then I'm going to ask questions that are similar to the ones on our survey to get a discussion going and just see where everybody's at, like what they know, what they don't, what they're interested in, and all that good stuff. Then I'm going to present information on teen pregnancy. Also, I'm going to present information on contraceptives. Then I would show and display the different types of contraceptives, like if I were actually in a face-to-face group, I would be able to pass the contraceptives around and so people can see the different types. Then I would split the participants into groups so they can review the contraceptives, where they can name them and know how to properly use them. And additional resources will be provided. So for my seating, I chose the circular seating because it provides more of an openness and equality. Everyone's able to interact and everybody can see each other. And also because the health educator is part of the group. So it's not like, just look at the instructor. No, she's part of the group so you can have more of an interaction. The materials and supplies that I would need is a PowerPoint, a laptop, a projector, and then I would bring like the different types of contraceptives like condoms, birth control pills, a cervical cap, and more, just so people can see how it looks like. And I would also bring a female and male reproductive model in case demonstration needs to be presented or how to do something where they can gain more knowledge. My statement of objective for psychomotor, participants will be able to demonstrate how the contraceptives are placed and used on the models. And then participants will be able to list the effectiveness of the contraceptives. My statement of objective for cognitive, participants will be able to discuss factors that can contribute to teen pregnancy. And then participants will be able to list 3 new facts that they didn't know or found interesting. My statement of objective for effective, participants will be able to make safer or responsible choices. And participants will be able to understand the different types of contraceptives and choose one that suits them if they do decide to choose one. It's all based on what they are comfortable with, and in this whole process, nobody will be forced to do something that they are not comfortable with. So my survey findings, everyone had graduated high school, and the ages varied from 19 to 36. 10% are male and 90% are female. I asked, are you sexually active? 80% said yes and 20% said no. Then I asked, have you ever received information about the dangers of teen pregnancy and unprotected sex? Everyone said yes, which I'm glad because I was expecting that everyone at least heard something. Then I asked, where did you receive information about the previous question, which was the information of teen pregnancy and unprotected sex? 60% said school, 30% said family and friends, 10% said magazines and the internet, which, I mean, I was expecting because everybody's different. Not everybody obtains information the same way or is taught in the same environment. Then I asked, in your opinion, why do teenagers get pregnant? 40% answered because they're irresponsible, 20% said by mistake, and 40% said poor education on pregnancy, which all three of them are reasons why teens get pregnant. And then I asked, have you ever been pregnant or gotten a girl pregnant? Only 10% said yes, 90% said no. Then I asked, how often do you or your sexual partner use protection when having sex? 40% said always, 10% said usually, and 20% said sometimes. 10% said rarely, and 20% said never, which I was expecting too because it's a range of everybody. Not everybody does everything the same, and everybody chooses to do something completely different than other people. It's okay. And then I asked whether or not you have been sexually active in the past. Does the thought of possibly getting pregnant or a girl pregnant at a young age influence your decisions to have sex? 30% said yes, 40% said no, and 30% said sometimes. So now I have more information about teen pregnancy. So experts suspect that teens today are delaying or reducing their sexual activity, and then others believe that they are becoming more educated about contraceptive methods, being more proactive about preventing pregnancy, which is good. The more knowledge they know, the more likely they are able to prevent pregnancy at a young age. But there are risk factors that can make teens more likely to become pregnant. And then these include individual, social, and family risk factors. When it comes to individual risk factors, it's like being a victim of sexual abuse, having a lack of knowledge about contraceptives, and maybe even having negative attitude towards using contraceptives. Some social risk factors include dating at an early age or dating older people, being pressured to have sex from peers, friends who are sexually active, and poor peer relationships. Some family risk factors include having a family history of teen pregnancy, having limited communication between parents and the teen, negative family interactions, and being in a single parent family. So my take-home message, I have two handouts. They're both about contraceptives. One with pictures and the other one has more information about it, what type it is, the method, the effectiveness, advantages, disadvantages, all that good stuff. I think it's good to have to refer back if you need to. And this concludes my presentation. Thank you.